Bridge, New Frontiers in Type 1 Diabetes.
The onset of type 1 diabetes is actually not the metabolic disease, but it is now stage 1. So you may ask, can I screen and diagnose really when this disease starts, at the onset of this disease, and how would I do it? And then you go to your regulators, to your ministry, and say, listen, I would like to start a screening program to start screening for the onset of type 1 diabetes. And then they ask you, yeah, what is the benefit to really do this screening for asymptomatic disease? And when we started the FRIDA study in 2015 is a first public health screening program for islet antibodies for early stage type 1 diabetes. We also, from our ministry, heard you have to make sure that you can show the benefits. And here on this slide, you see some of the benefits of early detection, namely people who are diagnosed with the metabolic part of the disease when they already knew this by being screened before. They had a much better HbA1c at the metabolic onset of stage 3 diabetes. They had a lower fasting glucose. They had still more beta cells preserved, a higher C-peptide, and they almost had no symptoms and did not lose weight, just indicating that they were diagnosed at the right time and insulin was started at the right time. Also, life quality was higher because when we compared them to those who had not participated in screening programs, and you see them on the left side, these were our registry children, they had a higher stress score, both fathers and mothers of those children, compared to those participating in the screening, at the screening, and also in the long-term follow-up that were almost to those control population, healthy children of their age. And then we looked also at the societal impact and of benefit of screenings. And if you modeled that 90% of your population would really take place at a screening, and you would start now in your country to screen, then you could predict that after 20 years, you have significantly reduced DKA rates in those children, and that was also seen on a patient level. I didn't mention that, was only 2%, 8-fold decrease. Then we would also see a decrease of symptoms, a reduction in days in the hospital, and also much less children that have weight loss and symptoms, and starting this disease really in a stress situation, maybe even on intensive care.
Bridge, New Frontiers in Type 1 Diabetes.